Most children with syphilis are infected before birth. Congenital syphilis. The bacteria pass from mother to baby through the placenta, sometimes during childbirth. This can happen at any stage of pregnancy, but untreated infections pose the highest risk. Rarely, a child might get syphilis through direct non-sexual contact with an infectious sore, but this is extremely uncommon. In older children and teens, sexual transmission or abuse is possible, but the focus remains on congenital cases. Preventing mother-to-child transmission through prenatal care is where we can make the biggest impact. Early screening and treatment for pregnant women are critical. Stopping congenital syphilis starts before birth. Congenital syphilis is a serious infection that can be difficult to recognize in newborns and young children. Some babies may appear completely healthy at birth, while others may show clear signs of illness right away. In many cases, symptoms can be subtle or delayed, making it challenging for parents and healthcare providers to spot the infection early. This is why it's so important to be aware of the possible warning signs and to seek medical attention if anything seems unusual. Early symptoms of congenital syphilis can include a distinctive rash, often appearing on the palms of the hands or the soles of the feet. This rash may be copper-colored and can sometimes be mistaken for other common childhood skin conditions. Another early sign is a persistent watery runny nose, sometimes called snuffles, which can be a clue that something more serious is going on. Babies may also be unusually irritable, have trouble feeding, or fail to gain weight as expected, all of which can be signs that their bodies are fighting an infection. In more severe cases, the infection can cause swelling of the liver or spleen, which a doctor might notice during a physical exam. Jaundice, or yellowing of the skin and eyes, can also develop, signaling that the liver is under stress. Some infants may experience pain in their bones or joints, which can make them fussy or reluctant to move certain parts of their bodies. X-rays may reveal bone abnormalities, even before symptoms are obvious. If congenital syphilis is not diagnosed and treated promptly, the infection can become silent for months or even years. During this time, the bacteria continue to cause damage inside the body, even if the child seems healthy on the outside. This silent phase is especially dangerous because it can lead to serious, lifelong complications that only become apparent much later. As children grow older, late symptoms of untreated syphilis may begin to appear. These can include dental abnormalities, such as notched or peg-shaped teeth, as well as hearing loss that may go unnoticed until a child has trouble responding to sounds. Vision problems can also develop, sometimes leading to permanent loss of sight. Bone deformities, such as unusual curving of the legs or arms, may become more obvious as the child grows. Some children develop a collapsed nose bridge, known as saddle nose, or bowed legs, both of which are classic signs of late-stage congenital syphilis. These physical changes can affect a child's appearance and mobility, and may require ongoing medical care or surgery to manage. The infection can also affect the nervous system, leading to neurological issues such as developmental delays, learning difficulties, or even seizures. These problems can have a profound impact on a child's ability to grow, learn, and interact with others, and may require specialized therapies or support. Unfortunately, many of these late effects are permanent and cannot be reversed, even with treatment. This highlights just how critical it is to detect and treat congenital syphilis as early as possible. Parents and caregivers should be vigilant for any unusual symptoms and seek medical advice if they have concerns. Recognizing the warning signs and acting quickly can make all the difference. Early diagnosis and treatment can prevent the most serious complications, giving children the best chance for a healthy future. Healthcare providers play a key role in educating families and ensuring that at-risk infants are tested and treated promptly. With early intervention, many children with congenital syphilis can go on to live healthy, happy lives. Timely treatment not only saves lives but also protects futures, allowing children to reach their full potential.